Hi, so today I want to talk with you a little bit about bicep tendinitis. The bicep tendon attaches to the bicep muscle, as you can imagine. You have a distal bicep tendon that crosses the elbow, and you have a proximal bicep tendon that crosses the shoulder. This muscle can be put under strain anytime that the elbow is out and in front of the body. So we see injuries of the bicep tendon either where somebody's on a computer all the time and the shoulder is in front, the elbow is in front of the body and the shoulder is flexed. The sustained position there can cause a strain on the bicep tendon. We also see somebody whose bicep muscle is flexed, something comes and lands on the bicep muscle and can tear the tendon off of the front of the bone. When we talk about bicep tendinitis, we're really talking about two different terms. One is a true tendinitis. A tendinitis would be an inflammation of the tendon. Possibly I was working at work and I spent a long time working on the computer in the same position. I went home and my shoulder was very painful. My shoulder's painful like that, that would be called a tendinitis if it lasts for less than about a 2-week period. At the point that it's lasting longer than 2 weeks, then the shoulder has not healed, the tendon has not healed, and it turns into something that we call a tendinosis. A tendinosis would be considered maybe a diseased state of the tendon versus inflammation of the tendon. So with a tendinitis of the shoulder, we see things like ice and rest and maybe anti-inflammatory medications can really help to improve the condition and the pain at the shoulder because they are all treating the inflammation, the swollen, irritated, hot, and painful shoulder tendon. However, once it's been 2 weeks of being continuously irritated and never really coming out of that painful state, the shoulder tendon can actually turn into kind of a diseased tendon. It's not healing well, and so scar tissue is forming within the tendon instead of clean tendon tissue. And because of that, now the tendon can't stretch and move and pull like it used to because now it has a clump of scar tissue in there. That disease state of the tendon can last you for a longer time. So it's very important that if you do have a tendinitis of the shoulder, especially the bicep tendon, that we get it healed within about a 2 to 3 week period. So we would use the term tendinopathy to include both the tendinitis and the tendinosis conditions. And a tendinopathy of the bicep tendon is usually going to be caused by some kind of repetitive positioning or some kind of a sustained positioning. It's very common in office workers. It's also very common in anybody who's up here and having to shove down. Imagine a volleyball player or a basketball player who's up at the net, or somebody who plays tennis a lot. The position of the shoulder away from the body can cause a strain to the tendon. The symptoms that we usually see, usually kind of a dead arm feeling. The shoulder is painful. It's not often that the person with the bicep tendinitis can pinpoint where the problem is happening, but they're just feeling that the whole shoulder and the whole upper arm is causing them pain. In a chronic bicep tendon condition, it may be indicated to have an x-ray taken. The bicep tendon sits between within a groove between two other bony segments, and as the bicep tendon is moved back and forth like that, it can cause this continuing tendinitis. So sometimes what we're looking for is whether there's a spur or some kind of a jagged edge to one of these bones that's causing this constant motion. There's also a ligament that runs across the top that is supposed to hold the tendon in between these two hills and in the valley. If that ligament is stretched out, then that tendon is more likely to bounce back and forth and become inflamed. So very often an x-ray may be taken of the shoulder, make sure there's nothing else going on. Sometimes an MRI. And what they're looking for is to find out whether the tendinitis is just the inflammation of the tendon from crossing back and forth, or whether it's truly that the tendon has torn a section off of the bone. If the bicep tendon is just irritated, then most of the time you're going to come to therapy. We're going to use anti-inflammatory techniques very similar to what the physician brings on. You may end up with an anti-inflammatory medication from the physician, usually rest, maybe even positioning in a sling if it's a very acute pain. We may likely do ultrasound to the area to reduce inflammation there. We may also work with you on strengthening the other muscles, finding a way to be at your workstation without irritating that bicep tendon, being able to pull the computer monitor and the computer keyboard closer to you so that the arms are not out in front all the time like this. Otherwise, once we heal this bout of tendinitis, there's a good chance it will come back. So we do have to change the behaviors that may have been the cause of the tendinitis. Now, if during the x-ray or the MRI, if one was performed and it was found that the tendon has actually torn off of the bone, maybe 25 to 50% off the bone, and it's not healing itself, which can happen, and or the symptoms that you have are not going away within maybe a 3-month period, there's a likely chance that surgical intervention is going to be necessary, and that would be for 2 reasons. One is to reattach that part to the bone. If it's less than 25%, then maybe just removing that section of the frayed tendon, possibly shoring up that ligament that runs across those 2 hills and keeps the tendon in the valley. Afterwards, we're going to have to protect that bicep tendon. So when you come to therapy, we're going to be talking about stretching other groups of muscles, positioning in safe positions, making sure that you're not in a position where that arm could be up here and that bicep tendon could be stretched because it would be impacted by a ball or by another person or playing football or playing tennis. How is it that you're going to make sure not to re-injure that bicep tendon once the surgery has been successful? So how can you prevent bicep tendinitis and bicep tearing? Biggest thing is make sure that overhead activity is at the minimum. If it's part of your sport, then you need to specifically be strengthened to be able to tolerate that. It's not just the job of the bicep muscle to keep the shoulder together, obviously. We have a lot of other muscles in the same area that will help to protect that bicep tendon. So make sure that you work with your trainer, make sure that you work with your physical therapist on how to get you back to doing this sport, but not putting the majority of the strain on the bicep tendon. Make sure also that if you do start to have a little bit of tendinitis, that you enact very quickly some of the anti-inflammatory treatments we talked about. So ice and rest, maybe even positioning, definitely changing your workstation if it's a repetitive motion kind of thing or if it's a sustained motion, changing up some of your activities to not only be right hand dominant but maybe also to be done with your left hand, putting groceries away, moving back and forth between hands so that it's not such a strain on one arm. Either way, we'd love to see you in the clinic. We will take good care of you. We'll make sure that we not only fix the current problem, but we give you the education, the information you need to keep it from happening again.